Hi, you have Everyday Valkyrie, and today we're going to talk about how to make a birth plan. On paper, more often than not, people take just the idea of how they want their birth to go, and then they put it into something kind of like this document. When we had my daughter, I had a doula, and this is her outline idea of how to make one. So we're just going to run through it. There were a few websites that she directed me to, so we'll just get all those together and then we'll talk about each thing. All right, so let's go ahead and look at this. Move that out of the way real quick. Okay, so right here, you want to go over your due date, who your care provider is. So that's yours, that's your OB. What hospital you plan on delivering at, the pediatrician you chose. If you haven't seen it yet, the packing for going to the hospital, I go over some of the documentation that you need to go through and put together in a manila envelope or a folder of some kind or something. Will include information on your pediatrician. And to choose a pediatrician, you can either go online or do meet and greets. There will be another video about different questions you can ask your pediatrician if you're meet and greeting them, or if you just like to email them and ask them their positions on various things. For right now, if you need to reference that point, go ahead and go back to the other video to get more information. So then you lay out your plan and your goal. So which is essentially saying, like, either you're flexible or this is exactly how you want things to go, who's going to be in the room for you, all that kind of stuff. So this is just the overall goal. Preferences for labor and birth is who you want to have in the room with you during your labor and delivery. The limits that you want to lay out for labor. If you really want to just let labor just kind of go until you're ready to go, then most doctors, most midwives, most doulas will recommend that you labor at home until you reach a certain point in your contraction progression, that you then go to the hospital and you can finish your labor there and then deliver. And then fetal monitoring is very common. They'll strap it's like a little circular doodad that will go right on your belly. It has like an elastic strap on it, and it'll just constantly monitor the baby. Now, if you are a person who wants to get up and walk around, or to be able to move, to labor in different positions, if you want a water birth, all of that will require intermittent fetal monitoring versus continuous. Continuous means you're laying on your back, it's strapped to your belly, and you're not moving. You're just laboring in that position. If you've seen any movies like The Business of Being Born, Milky Way, doula, midwives, why not home, all of those videos, and more often you're starting to hear doctors also say it's better if you are moving, if you adjust your hips, because adjusting your hips allows for the baby to move down the birth canal. And so you want the flexibility in your body to be able to move. If you have a desire to like turn over and sit in a certain position, it's because your body is requiring that for the way that the baby needs to move into the birth canal. If you're laying on your back, then your body is doing all of that work versus gravity. So your uterus is having to push the baby into that position, and then the baby has to ride up over your pelvic bone, and it's just a lot easier if you're up and moving. So yeah, so that's all laid out there. Pain management, a lot of women will say, no, I do not want an epidural, or yes, I want an epidural. And it's better if you say, hey, I'm open to an idea, but this is where the line is. I don't want a full-blown, like, indefinite epidural, but maybe you would like just a tiny bit to take the edge off the pain so you can think, so that you can take a breath, whatever that is. If they've given you Pitocin, maybe just to have it for an hour and then just rest. There are different things to do as far as interventions. C-sections, obviously, only if it's 100% necessary. Vacuum extractions, the inductions, the swiping of your cervical opening to trigger labor, all of these things, if you would like your water broken, those are all interventions that need to be discussed. And if you don't lay that out, the doctor is just going to assume that you want to do what they want to do. So if you don't have a doula, if you don't have a midwife, you're just going in for an OB, your birth plan needs to lay out exactly how you would like things to go. So while you're in labor and not thinking, because you're not, that they have some guidelines of where you'd like your birth to go. Newborn and postpartum care, if you would like to hold your baby right away, do skin to skin. If you would like the umbilical cord to, most times they'll wait 2 minutes now, but if you would like all of the blood to go through the umbilical cord, then you need to lay that out also. I think they've said something like 50% of the baby's blood is in the umbilical cord upon birth. And so waiting for all of that blood to get into the baby is essential for your baby being able to bounce back after labor. I mean, after delivery, because it's hard. It's hard on you, but it's also hard on a baby. So giving those few moments, or if you desire a lotus birth or whatever you're doing, that you have, that the baby has that time to get all the blood through the cord, or as much as possible. Standard wait time is now 2 minutes. There's still blood in the umbilical cord. If you're doing blood banking, you want to snip that right at the 2-minute mark and then have that sent off. Yeah, all of that. So those are all in the postpartum care in the umbilical cord. Breastfeeding as soon as possible, obviously awesome. If you're not one who plans to start breastfeeding, then feeding the baby right away is still really good. But you need to lay out if you plan to exclusively breastfeed, or if you are okay with either or. If you're okay with either or, more often than not, they will push formula to like maintain body weight so that they can send you home sooner. Breastfed babies do have a tendency to drop just a couple ounces. And that's completely normal across the board, but breastfed babies have a tendency to drop just a few more ounces than that, just because breast milk isn't heavy like formula, and so it doesn't sit very long. And so you get down to actually what is actually going to be their weight fairly quickly. And then if you would like to be present for all procedures. So if you are indifferent to that, they more often than not, for blood draws, heel sticks, the testing, the echo, if they need to do that, all of that will be done outside the room so that they don't have to bring the equipment in. But if you would like to be present, they'll bring that equipment in and they'll do it there in your maternity room. Labor events, obviously, so if you have a C-section, whether you want your partner or doula or midwife or whomever there for all, for the whole time during the operation, or if you would like them to be there until the baby is taken away. I personally sent my husband with the baby, and then because I couldn't be there and I was really attached to her, and that was really, really hard for me. If you would like your partner to do skin to skin, that needs to be laid out. When you want your baby to be breastfed, all of those things. Now, the other thing that is included in newborn and postpartum care is birth plan template, newborn procedures. This website, givingbirthnaturally.com/newborn-baby-care.html. It goes through all of the newborn procedures and what the different procedures are for suctioning, delayed cord clamping, newborn vitamin K injection, PKU test, silver nitrate or antibiotic eye ointment, the Hep B vaccine, and then bathing and circumcision. All of these are to your own discretion. You can hold off on any one of them, but it has to lay out in your birth plan document. And then there are times where they will have you sign off on the fact that you are refusing to accept a certain treatment versus the doctor refusing to give it. So if they refuse to give it, obviously they're at fault if something happens. But if you refuse to receive it, it's entirely different. The silver nitrate antibiotic eye ointment, that is to protect babies against STDs more often than not, to protect their eyes. But it is not necessary if you do not have an STD or if you don't have a yeast infection at the time of birth, vaginal birth. C-section, it's not really necessary at all. It's to protect the baby's eyes. However, it does sting and it makes the vision even more blurry than it is. So it's really, it can be difficult on babies' eyes. Sometimes they just do it. They don't even ask and they don't consult your birth plan until after, and they're like, oh, sorry. So you want to make sure that's 100% clear between you, your partner, and your doctor. If you don't want that given. The Hep B vaccine, it is given. My daughter, we had a very interesting C-section birth delivery. They needed to do a ton of tests on her because they thought that she had some crazy disease that she did not in fact have. So we opted to wait for the Hep B vaccine because she was being stuck all the time with needles getting blood draws. We waited until her first newborn visit at the pediatrician's to get the Hep B vaccine. It's not awful. It's not bad. It is what it is. And then the vitamin K injection is way more effective and potent than the oral delivery. The oral delivery, more often than not, if you do that, has to be given up to 2 to 3 more times to make it effective, whereas the injection just needs to be done once. Bathing, sorry, I have mom brain. So the vernix that is on the baby, which is that white creamy stuff that is just covered in babies. You see it all the time in movies. You'll see it in birth photos. Like, it's just the baby's covered. And that is really, really good for the baby. It is a lubricant. It is a type of lotion. It is also a small type of sunscreen. It protects against bacteria and all the different things, but most importantly, drying out the skin. And the baby just came from a wet environment and is going to an incredibly dry environment. I don't know if you've noticed in hospitals, you get chapped lips, your skin is dry, it's flaky, like it's crazy in a hospital. So the vernix is really good just to keep baby's skin moisturized. So if you can, it's better to wait to bathe the baby. So the baby isn't bathed right away, but later, either that evening, the next day, to the end of the week. Like, it would be best to wait and let that just sit on their skin and be absorbed naturally so that their skin acclimates well. And then circumcision. There's tons of research on circumcision that you can do. There is a really great video on Netflix. It's a series called Adam Ruins Everything, and he explains circumcision really well. There's also a video on Netflix right now. I don't know how long it'll be there. It's called Circumcision in America, and they go through the circumcision process. So you could watch those and educate yourselves. That would be really good. The PKU test is essential. Suctioning is not essential, but sometimes if the baby is stuck, they will like need to help pull the baby out, and that's the only way to do that. So yeah, so that goes over all of those things. You have tons of options, you have tons of rights, you are entitled to do a great many things. Maybe one of your other options that you need to lay out in your birth plan is that you will have a birth photographer present to capture those moments. You'll need to have a list of people who are allowed in your room during delivery and go over that with your doctor to make sure that it's all good. If you don't have a birth photographer, obviously you don't even need to mention it. That's fine. Placenta encapsulation is another option that many women have started taking. That needs to be in your birth plan. That needs to be vocalized to your doctor, and you need to mention it to the nurse when you come in so that they know when they send it down to the lab for testing. They inject it with a dye to make sure that everything is healthy, and that's the easiest way to do it. However, if you are saving your placenta for consuming, then it needs to be done a different way. They need to test it differently. So the dye isn't safe for consumption. You need to make sure that they know that you plan to do that. Placenta encapsulation has gone through a nice little roller coaster of sorts, in that like it was really great for a hot minute because it helped with breast milk. It does not. Placentas are chock full of progesterone, and that kills your prolactin production. So it will actually hinder your breast milk production if you are breastfeeding. If you are trying to kill breast milk, that's a great way to do it. It does help with getting those hormones on track to like tighten up your uterus, but like I said, it is not great if you are breastfeeding. It's best to just let it go. There are tons of breast milk, galactagogue type foods that you can eat, you can consume, you can take vitamins and nutrients, all those kinds of things to help you with breast milk production if that is what you are trying to do. You can also stimulate breast milk and labor by starting to hook up and work with your breast pump, which is free through your insurance. Contact them. Like I said, this was my doula, so she provided all of this information, and we were living in Washington at the time. So this birth photographer, unless you're in Washington, is not local probably to you. So do some research. There are probably tons of local birth photographers, and that more often than not, birth photographers also do what they call Fresh 48. And that is the first 48 hours when the baby is fresh and new and still teeny tiny and all of that stuff. They'll come in and take photos for you in the hospital or right when you get home to take photos of your new little baby to help with announcements or just letting everyone know that the baby got there safe or whatever. If you are in Washington, Annalise is amazing. Minnesota has, there was a Prego Expo a couple months ago, and they had several great photographers that are available in the Minneapolis-St. Paul area. They're great. They all do Fresh 48, and 90% of them said that they did birth photography. So that's how that all goes. If you have any questions, if you contact your local midwife or your local doula, or if you have a doula, or if you're planning any of that, those people are available to answer any questions that you have and to go over the process in the local hospital that you may have, the process for an epidural and Pitocin, what the different interventions are in your area. Some are different. Some in rural areas, they don't even wait for you to be induced. If you are running over, if they feel at any point that you are in danger or your baby is in danger, they will probably run straight to C-section, just because they don't take chances in rural areas. If you're in a big city like Minneapolis, Seattle, St. Paul, Atlanta, I don't know a ton of big cities, they will probably wait and monitor you very closely. You are entitled to turn that down if you want, but that is how that all goes. If you have any questions for me, please leave them in the comments. Please hit subscribe, and we look forward to making the next video with you.